Welcome to this video introducing INVO IVF. INVO is a simplified, low-cost IVF procedure that may be an attractive alternative for many families. We make use of the unique INVO system to reduce the medical technology and hence the cost for IVF. Let's begin by explaining how INVO differs from the usual IVF procedures performed in most fertility centers. With conventional IVF, patients are treated with high doses of injectable fertility medication to stimulate the growth of 10 to 30 eggs in their ovaries. This treatment usually requires 3 to 4 visits to the clinic for ultrasound examinations and blood draws. When the eggs are ready, egg harvest surgery is performed. Due to the large number of eggs produced by the fertility medications, procedures are usually performed in a surgery center where patients are put to sleep for egg retrieval. Sperm and eggs are then mixed in the IVF laboratory and grown for 5 to 6 days with intensive monitoring. Embryos are then returned to the woman's uterus with a pap smear-like exam. Conventional IVF is a very effective treatment. Unfortunately, it is also a very expensive treatment. Each of the steps, treatment with high doses of fertility medications, surgery for egg harvest, intensive monitoring in the IVF laboratory, requires expensive technology and personnel. The result is that the typical IVF cycle might cost $10,000 to $15,000 with medications. INVO IVF is a simplified procedure designed to offer the benefits of IVF at a reduced price. With INVO, patients are treated with a low dose of fertility medications. As a result, most patients produce 3 to 10 eggs. This makes it possible to perform egg harvest in the office with a light sedation. Eggs are identified and mixed with the semen and placed in the INVO fertilization device. The key difference is that the INVO cell is then placed in the woman's vagina to allow embryo growth in her body over the next 2 to 5 days. Using the INVO cell both eliminates the expense of the IVF laboratory and may provide more natural conditions for embryo growth. To complete the procedure, the INVO cell is removed from the vagina. The embryos are returned to the woman's uterus by a standard embryo transfer. Thus, INVO IVF is a simplified version of the IVF procedures doctors have been performing for over 30 years. This simplification allows a substantial reduction in cost, making this care available to a wider range of families. Now that you understand the basics, let's follow a patient through an INVO cycle and explore her treatment in detail. There are 3 simple steps to INVO care. First, patients are treated with a low dose of injectable fertility medications over the course of 10 to 12 days. In a typical treatment calendar, patients are seen for an ultrasound exam on Friday morning. Our team will show you how to take a daily injection of a low dose of the fertility medication Gonal-F with a simple subcutaneous injection. You will take this injection once a day for the next 10 days. This medication typically causes the recruitment and growth of 3 to 10 eggs within your ovaries. On the Monday following the initial treatment with Gonal-F, you will have an ultrasound exam to check the progress of your egg development. Most patients will have mature eggs at this visit or within the next 2 days. Once we know your eggs will be mature and ready for egg harvest, we will give you a final trigger shot that prepares the eggs for retrieval. Egg harvest is performed in the procedure room of our office. We use a very fine needle to pass through the wall of the vagina and into the ovaries to collect eggs. One of the special aspects of the INVO procedure is that we use such a fine needle that there is little or no discomfort with the egg harvest procedure. Patients are treated with oral Valium and narcotic pain relievers. The vast majority of patients report little or no discomfort. Since we don't have to use a general anesthetic, patients are both saved the expense of anesthesiologist services and are able to go home feeling well 15 to 30 minutes after their procedure. Next, the laboratory scientists look under the microscope to find the eggs in the ovarian follicular fluid. Eggs are mixed with processed semen in the petri dish. As a next step, sperm and eggs are placed in the INVO vaginal culture device. The INVO culture device is placed in the vagina where it rests for 2 to 5 days. Fertilized eggs grow from 1 cell to 4 cells after 2 days, 8 cells after 3 days, and 150 cells after 5 days. Patients return to the clinic to remove the INVO culture device. The technicians will identify the embryos from the culture chamber and prepare them for embryo transfer. For most patients, we will select 1 to 3 embryos for transfer, depending on your personal medical history and needs. Embryo transfer is a non-surgical procedure. A Pap smear-like examination is used to gently replace the embryos into the uterus. Next, patients are treated with medications to support pregnancy. We perform a pregnancy test 7 to 10 days after embryo transfer. INVO is an attractive alternative to standard IVF. The combination of a reduced dose of fertility medication, along with an office-based egg retrieval procedure and the use of the intravaginal culture device, allows us to offer an effective treatment for a fraction of the cost of conventional IVF treatments using a large dose of fertility medications. While INVO is a good option for many patients, it is important for you to be aware of the limitations of the procedure. Due to the fact that we are using a lower dose of fertility medications, many patients will have fewer eggs than women being treated for standard IVF. There is also a higher risk of premature ovulation, which could prevent us from going forward with egg harvest. Occasional patients will have no fertilized eggs or no high-quality embryos for transfer. In our practice, we believe that INVO is a good intermediate procedure between simple, low-tech therapies such as treatment with oral fertility medications and IUI, and expensive high-tech treatments such as conventional IVF. Please note, INVO is not for everyone. There are patients with medical issues such as severe male infertility who are best treated with standard IVF therapy. Please visit with your doctor to discuss the various options and to select a treatment that is appropriate to your needs. This ends our introduction to INVO IVF. Please contact the office to schedule an appointment with your doctor or one of the coordinators for more information.